Activists are finding it hard to stop the spread of the dreaded disease.
HIV in the Philippines, a problem that's been waiting to happen. For years, NGOs have been saying that the country is poised for an outbreak of the disease. Although cases have yet to breach the 5,000 mark, the outbreak may have just arrived.
Prior to getting HIV, I myself didn't know anything about it. I had no idea that, there were drugs available that could help maintain your lifespan. I had no idea the exact numbers that was going on.
Wango Galiaga is one of 528 cases of HIV/AIDS diagnosed last year. Since then, he has been participating in activist campaigns and discussing the disease on his Multiply site. Yet despite his efforts and those of others like him, the number of HIV cases in the Philippines continues to grow.
Basically what we have is an epidemic. You can't call it any other thing other than an epidemic because, a spike in the usual number of cases, that's how you characterize an epidemic. And there's no other way to describe the Philippines HIV/AIDS situation except an epidemic situation. That's what it is.
Since 2000, there have been an increase in the number of HIV/AIDS cases diagnosed every year in the Philippines, with more cases diagnosed in the first 9 months of 2009 than the entirety of 2008.
It's still sort of an abstract concept for most people because, 4,000 cases in a country of 88 million people, that's still a vanishingly small number. But I think that if we don't step up a campaign right now, then this is going to get out of hand.
While there are government and non-government organizations working to raise awareness about HIV, many efforts have been stymied by the cultural taboos that surround the disease.
Since we're a Catholic conservative country, people are not very open to talk about sex and their sexual habits. It makes it very difficult because you have to break through that before we can start talking about the real issues.
It's this aversion to discussing sex that has made it difficult for health workers and activists to dispel misconceptions about HIV and encourage people to take measures to avoid infection. Which means in the race to stop HIV in the Philippines, activists and doctors must combat the disease on both a medical and cultural level. Beth Morrissey, ABS-CBN News, Manila.